Presenter is Dr. John Sarkar. Water jet to let it set.
May I proceed, sir?
Yes, yeah.
Very good evening to all of you. I'll be presenting water jet to related sets. I have no financial interest. This is a dissect plan for the traumatic, surgically traumatized eye. This is a Uber driver, surgery done somewhere else, so refer to cornea clinic. Initially, I thought I will do the clubbed up with the another eyeball, but superior wound is so bad, I'm sitting on the inferior temporal part, so I'm planning only dissect. Everything all right up to that point, but now the real game started. So as I am just planning to putting the inserting the graft, now the PMMA IL was propped up as there was no Irish support. So on table I decided to using the irrigation cannula in a polish mode, which will support the IL and maintain the anterior chamber like SM. Just like we're inserting sometime, I will, and just see how smooth they have done it without hatching. Single stroke entry, we've done it, and got a good post-op, and patient so happy. I've done the other eye echo and maintained the 6/12 vision for the last 2 years follow-up. Thank you very much.
Sir,
Yes, sir.
AC maintainer will also work the similar way?
Yes, sir. SA maintainer is there. Though it's a on-table decision as I didn't have the SA maintainer ready on. So on table I decided what can be replaced the SA maintainer. So we have a ready-made in our hand the AC, that is the irrigation cannula. We maintain the polish mode. So maintain the anterior chamber just like this. Some of us using the inserting the eyeball only in the AC maintainer. That's like that only. So I just simply converting that technique to insert in the dissect disc, and it's totally very smooth and uneventful. It's supposed to be very much eventful. That is the 2 minutes.
So your one hand is tied with the
Yes, sir.
irrigator.
Yeah, I just holding these things just like a supporter, irrigation port, and maintain the thing in the maintain mode. That, but I have to extra adding my legs just like polish mode and inserting this as if I am just keep in mind I am just inserting the eyeball. I just forget I am inserting the dissect disc. So it's a mental block only, sir. And that take home message.
Thank you.
Thank you very much. Thank you.
Thank you. So, Dr. Sanjay Chaudhary, please.
So this thick plaque came up on the posterior capsule, and we were weighing our options. How should we manage it? So I'm going to show you this sudden surprise thing before us. Bhaiya, start kar do.
Yeah.
Play.
Time at
What do we see here?
This is with sound.
A thick plaque on the posterior capsule. It is so thick that if I leave it, the patient will not have a good vision. If I try to remove it, it's most likely I'll puncture the posterior capsule. If I try doing a yak capsulotomy in such a thick plaque, even that would not work. Let me try to scrape it off the posterior capsule. Let me try this capsulotomy needle. In case I can't scrape it off, I'll puncture the posterior capsule and do a posterior capsulorhexis. And my pressure should not be too much. Slowly, patiently. Hey, it came off. It came off the posterior capsule, and the posterior capsule is intact. Wow. And now I continue to tease off this plaque with a microforceps, and it is working fine. Just a little bit of strip left. Now microforceps in the left hand, I'm trying to shave it off, the posterior capsule. And yes, I'm successful. The posterior capsule is still intact. Yes, we did it.
Jagatram sir.
I think this was very nicely removed and very carefully handled because your force which you applied. If you apply sudden force, then it can rupture. So
True.
very slowly, steadily, uniformly, I think you have pulled it, and it was excellent.
Thank you, sir.
Your fantastic exposition and equally fantastic, what do I call it, the validation done by one of the greatest authorities in India. What more can I say?
Thank you so much, sir. So next.